My first step, put my gloves on, right? I've already got permission. I've already done all that stuff. I just want to show you the basic steps. Then I'm going to run it under cool water for about increments of 10 to 20 minutes and just cool that area really good. The reason we start with water and cooling it off is because you can get what's called secondary death. Just like if you get a severe sprain and you don't cool it off, you don't ice it. What happens in secondary death is if this area gets inflamed and gets really hot, those cells use up more oxygen and they create a hypoxic condition for the rest of the cells. So more of them die than should. If you ice it, you slow their metabolism down and less of them die off. But we don't want to put ice directly on a burn, so we put cool water and we run it under cool water. Once we think we've got it cooled off, I could give her ibuprofen to take to help relieve some of the inflammation and pain that's associated with it. And ibuprofen is perfect because it's anti-inflammatory. So once I've done all those things, I want to put triple antibiotic ointment and cover the wound because I don't want it to get dirty while I transport her to the hospital. This type of gauze is made for soaking up blood. It's not the best thing to use for a burn. If you've ever been in the military and you've seen those burn pads that they almost have like a Teflon, flexible Teflon-like coating. It's not made out of Teflon, but it's really slick so it won't stick to a burn, and it's already saturated, like it's in a fluid, so when you rip it open, it's already saturated with an antibiotic ointment. So then you cover the wound. If this is all you have, take your antibiotic ointment, cover the wound, cover more on this sticky dressing, so that way you just lightly put it on the wound, just to cover it up, and then you can take an elastic roller bandage and you loosely wrap it. So like in bleeding, we want it tight to help restrict circulation. In burns, whatever we wrap it with, we want it to be loose, just enough to keep the gauze in place and cover the wound up, but not enough to put too much pressure to stick to the wound, because if this is second degree and above, so let's say I've got it covered, I'll just stop right there. When she gets to the hospital, if I used a lot of pressure or something that was really sticky, it's going to just tear that skin off, and now that's more open to infection. So you want something that's non-stick, loosely wrapped, and now I could take her to the hospital to get treated, and they would clean up the wound. Never pop those blisters, because now you've opened up that wound to the outside environment and you have a higher risk of infection.